I'd like to welcome you to the 2021 Kresge Eye Institute Vitreoretinal Fellowship interviews. Unfortunately, they're virtual this year, but I think that you will get a very nice picture of the program, and you'll be able to get full discussion with all of the faculty as well as the fellows. Welcome to Kresge Eye Institute. This is a virtual welcome to you as an applicant to our Vitreoretinal Fellowship program. We have a 2-year Vitreoretinal Fellowship that is in full compliance with the AUPO Fellowship Compliance Committee. We have a total of 3 fellows. We recruit 2 fellows and 1 fellow in alternate years. So for the 2021 cycle, where we're currently recruiting, we are recruiting 1 fellow. We have 4 vitreoretinal faculty members at Kresge Eye Institute. I'm the fellowship director. Chris Chapman, C.C. Lin, and Deepa Yoganathan are the other vitreoretinal fellowship members, or the faculty members. You can find a full description of their biography and their training in the packet that's been sent to you. So, as far as the fellowship, the fellows begin both medical and surgical training at the very beginning of your fellowship. So there's no medical rotation or a designated surgical rotation. You're going to be doing both throughout your fellowship. The fellows are in the clinics and the operating room from the very beginning of the fellowship. The way it works is the fellows rotate with the faculty members by the month. And currently the way the fellows are assigned, 1 fellow is assigned to Dr. Yoganathan and myself, 1 is assigned to Dr. Lin, and 1 fellow is assigned to Dr. Chapman. The fellow assignments will be to the faculty clinics at Kresge Eye Institute. There's 2 resident clinics per week, 2 resident retina clinics per week at the KEI resident clinic. And there's a retina clinic at the Detroit John Dingle VA Medical Center where you will spend time. The surgery is done at the ambulatory surgery unit at the Detroit Medical Center Heart Hospital. It's a very nice new operating suite. Most of the activity of the fellow is at the Detroit Medical Center Central Campus. It's interesting that all of the DMC hospitals, Harper, Detroit Receiving, Heart, and Children's Hospital, as well as the VA Medical Center, are all within a 3 square block area, and they're all within a walkable distance. I think one thing all the fellows are interested in is what's the surgical philosophy of the program. Well, our philosophy is that in order to learn surgery, the fellow must do surgery with excellent supervision. The surgical experience at Kresge is a progressive, graduated experience, and most fellows are peeling membranes within the first 4 months of their fellowship. The average number of procedures for the last 5 graduating fellows were, as far as pars plana vitrectomies, 272 as the primary surgeon and 43 scleral buckles as the primary surgeon. There's also a very large volume of laser procedures as well as injections in the outpatient clinics. So the surgical experience here is, I think, as good as you're going to find any place in the country. There's a very large volume of very difficult cases, such as diabetic traction retinal detachments and PVR. Understand that Detroit has a diabetic population with very high acuity. They're very difficult traction retinal detachments that you'll find. We also have very many of the usual cases, such as macular holes, macular puckers, retinal detachments, and you name it, diagnostic vitrectomies, whatever. You will learn to do a primary scleral buckle. That's become an issue at some of the training programs around the country. It's not a problem here. You will learn and you will become competent in doing a primary scleral buckle. The fellow is the primary surgeon on the vast majority of cases. The vitreoretinal faculty members are present during fellow surgery. We also have an eye-size surgical simulator at the VA Medical Center, and it has the vitreoretinal module, and we urge the fellows to work on the simulator at the beginning of the fellowship to move them along as fast as possible. Medical retina is good here. The fellows see a high volume of medical retina in the faculty clinics, in the resident clinic, as well as the VA Medical Center. There's very diverse pathology, including a lot of diabetic retinopathy, other retinal vascular diseases, age-related macular degeneration, inherited retinal diseases, as well as inflammatory and infectious retinal diseases. We have an outstanding imaging department here with full imaging capability. We have Cirrus and Heidelberg OCT as well as the Zeiss OCTA. We have standard and ultra-wide field photography with both TopCon and the Optos systems. And we have FA, ICG, as well as fundus autofluorescence with both Heidelberg, TopCon, and the Optos system. One thing that you'll probably like to hear, the injections for angiography are done by the photography staff, so you will not be asked to do those. We have a great electrophysiology laboratory with full field as well as multifocal ERG, EOG, dark adaptation. We have standard and multifocal VEP as well as microperimetry. We have an ultrasound laboratory with a full-time ultrasound technician, and you will learn to do ultrasounds yourself as well. Uveitis, I think, is a highlight here at Kresge. Dr. Lynn has a bi-weekly uveitis clinic that is attended by a fellow. I think uniquely we have a board-certified rheumatologist who sees uveitis patients in the clinic. So immunotherapy can be started and maintained in the uveitis clinic. So you as a fellow will learn to diagnose and to treat uveitis, including the most modern immunotherapy, and I think that's very, very important in this day and time. Fellows will see retinopathy prematurity patients with Drs. Lynn and Dr. Chapman at Sinai Grace Hospital, which is about 7 miles away from the central DMC campus, and at Hutzel Hospital here on the central campus and Children's Hospital. The fellows will also learn to diagnose ROP and to treat with both laser and anti-VEGF therapy. On-call responsibilities. Well, the fellows rotate retina call by the week. Each fellow is on call for retina for about every 3 weeks. The volume of emergency care is not excessive and is often seen by the resident on call before the retina service is even called. The volume of nighttime surgery is small, and most cases are done during the day. Weekends for the fellows are relatively free, with some postoperative patients to be seen and some emergencies to be seen. Well, what about salary? Well, we have a competitive salary. It's split between the University Practice Group and the VA Medical Center. So thank you for choosing the Kresge Eye Institute for your Vitreoretinal Fellowship interview. We really appreciate it. We look forward to meeting you and discussing the opportunities available here at Kresge. Please talk with our current and past fellows about the fellowship experience here. We will also provide a Zoom link so you can talk to our current fellows. Good luck, and I really look forward to meeting you. Thank you.